Hello, my name is Jim, and I'm a lab technician at the Center for TMJ and Sleep Apnea, Dr. Larry Pribble's office. And in this video, I'd like to talk to you about an oral appliance called the Somnodent oral sleep appliance. But before we get into that appliance specifically, I'd like to talk to you about reasons why you make adjustments to sleep appliances. The reason why anybody would adjust it is if they are snoring at night, having apnea events at night, feeling drowsy when they wake up, or if they're having daytime sleepiness. And you never want to make an adjustment to a sleep appliance unless the doctor tells you to. The main reason for this is when we adjust an appliance, it needs to be real small in increments because you can harm your jaw joint. Because the way an oral appliance works is that it takes your lower jaw and moves it forward to open the airway and let more air into your lungs to decrease your apnea symptoms. So if someone is making an adjustment to an appliance and they do it too far too fast, moving the mandible too far forward, they can do harm to their jaw joint and create pain and other issues, and we don't want that to happen. So always check with your doctor before you make adjustments. Now getting into this particular appliance, once again it is called the Somnodent, and it is a two-piece appliance, upper and lower, of hard acrylic. One thing you can do with this appliance is you can get a soft liner inside called a dual laminate, and so if the hard acrylic inside is hard on someone's teeth, they can get a nice soft lining in there and makes it more comfortable for them. So how this appliance works is you got your upper and lower, and the upper fits into the lower like this, and the part of the upper appliance here where the expansion screw is contacts the fin of the lower appliance and puts pressure on it, pushing the lower jaw forward. So if someone is still having apnea events, they're going to want to make adjustments to this appliance. And how you do that is through this key mechanism here. I don't know if you'll be able to see it on the video, but there's a small hole here, which is where this key would go. And there is an arrow here that points in a certain direction, and that's the way you want to turn your key. So the arrow is pointing the other direction on the other side of the appliance, but it doesn't matter how you're holding the appliance or anything, as long as you're turning towards the arrow, then you know you're adjusting it right. So once again, you will just put the key in the hole here and make one turn towards the arrow like that. Now one turn is 1/10 of a millimeter. So you'd have to do 10 turns of the appliance to get 1 millimeter advancement out of the mandible. And there is about 50 to 55 turns built into these appliances, so you get about 5 to 5.5 millimeters of advancement built into this appliance. So as you turn, this expansion screw gets wider, and as it gets wider this way, it'll contact the fin earlier and push it farther forward, which will advance your mandible, open your airway, and hopefully decrease your apnea events. So that's how you make an adjustment to this appliance. Now if we have a patient that has this appliance and they take it to their sleep study, they'll have with them a piece of paper called a sleep protocol, and the sleep technician there will read it, and it'll tell them how to make an adjustment to this appliance and when to make certain adjustments to these appliances during the patient's sleep study. So hopefully we'll be able to achieve an optimal position for their jaw to be in to decrease their apnea symptoms. So they'll know how many turns to do and when to do them during the sleep study. So that's important to have as a sleep protocol. So once again, this is the Somnodent sleep appliance, and that's how you make adjustments to it. Thank you for watching this video.